When using psychology to reduce a negative behaviour, such as eating sharp objects for a client, we first must conduct a functional assessment and then move on to an appropriate treatment once we've established what the consequences are that are reinforcing that behaviour. Reinforcers for such a behaviour could include attention from caregivers or parents, or maybe even just a self-stimulation in the mouth. To assess whether these are reinforcers or what the reinforcers are, we can ask the client or ask others around the client who can observe the antecedents and consequences of that behaviour. We can also use direct observation and observe the client ourselves in order to determine what's reinforcing the behaviour and making it continue. As part of our functional assessment, we may choose to look at pre-diagnosed mental or medical illnesses that may be impacting on that behaviour. Once we know what's reinforcing the behaviour, we can move on to treatment depending on what that reinforcer is. Differential reinforcement of alternative behaviours, or DRA, can be used specifically if attention is reinforcing the behaviour. During this process, we will put the negative behaviour of eating sharp objects into extinction or reinforcing the client for performing positive behaviours, which will also gain him attention, things like performing tasks well. One issue with using DRA in this case would be that to not intervene while the client is eating sharp objects could be dangerous to his health. So we do need to intervene while giving the minimum amount of attention. One variant of DRA is differential reinforcement of other behaviour, or reinforcing the absence of that behaviour, in which case we would reinforce for a period of time that the client doesn't display this behaviour. That will make the behaviour less attractive, less reinforcing, because it won't be reinforced by the attention that he was previously getting. If self-stimulation is a factor and it's reinforcing, we could find a functionally equivalent behaviour, such as eating a lemon or something like that, that would reinforce the client without putting him at risk through the harmful behaviour. Punishment might also be used, things like timeout or response cost, by taking away leisure time or anything else that may reinforce the client otherwise. In this case, the problem behaviour, rather than reinforcing, becomes a punisher because it's taking away these other reinforcers. Aside from looking at reinforcing consequences, we can also examine antecedents and risk situations, avoiding risk situations and using establishing operations to ensure that if attention is a reinforcer, the client is receiving enough attention so that he no longer needs to engage in this negative behaviour to receive that reinforcer. All treatments will be subject to the client's intellectual ability. Because this is a developmentally disabled client, we may try to use explanation to show that the behaviour is maladaptive. If this is unsuccessful, we might focus on more behavioural strategies. As with any reduction of a negative behaviour, we should try to promote positive behaviour in its place so that the person is still being reinforced and maintenance occurs and there is a lower risk of relapse. Thank you.